Dr. Ayers, thank you so much for joining us. I am so excited to dig right into our conversation on implicit bias, as I know you have so much experience and expertise in this area. So I'm going to start off with a great question, I think. In your experience, why is focusing on implicit bias important for healthcare leaders and teams?
As it relates to healthcare, we have tons of research that shows that organizations which prioritize implicit bias and training, diversity, equity, inclusion training, that these organizations actually do better than organizations that don't. So their bottom line financially, they outperform organizations that don't prioritize training around diversity, equity, and inclusion, and by extension, things like implicit bias. We know that through that research, employees and organizations that do this work and do this prioritization, that these employees feel better respected, they feel valued, they feel safe, and as a result, they're more engaged and more innovative. And that when we are able to manage diverse teams well, that we have better outcomes. And in order to do that, leaders have to be able to address implicit bias or unconscious bias, as it's also known, because of the differences inherent in diverse teams. So it's really important for leaders and organizations to really understand implicit bias as a way of managing the diversity that we know makes organizations better. And then finally, I would say that another area where it's important to address implicit bias is when we're talking for healthcare organizations, is when we're talking about outcomes and patient experience.
Can you talk more about the impact implicit bias can have on helping our goals, such as employee engagement or retention, or even quality and patient experience?
Absolutely. So when we talk about things like quality of care and healthcare, what we're talking about is outcomes, right? And we're talking about things like mortality, morbidity, patient safety, patient compliance with treatment plans, readmissions, length of stay, which, for hospitals matters a lot. And these are all things that are very, very tangible as they impact an organization's bottom line. And so, when we are looking at these things and examining them critically, we see how closely they are tied to concepts like implicit bias, where employees feel, when they feel valued, when they feel included, when they feel respected and seen. Likewise with patients, when they feel valued, when they feel respected, and when they feel seen, we have a more inclusive environment, right? And employees are more engaged, employees are happier, patients are happier. So it affects our patient experience scores as well. So we have to address those beliefs. We have to address those attitudes, those practices, those policies that create barriers to building that type of inclusive environment for our patients and our employees to fully participate. And these barriers often take the form of unconscious or implicit bias.
Wow. It's always fascinating, the parallels between what our patients are seeking and needing and what our employees are seeking and needing. And so then our role as leaders can become even clearer related to this topic of implicit bias and the impact we can have as we integrate that into our practice. So are you able to share, within your own organization, even some of the best practices that you've seen or experienced, whether it's in training or allyship and or addressing microaggressions?
Absolutely. So the topic of microaggression in particular, I think is extremely important. And so we want to first make sure we understand what microaggressions are. So these are subtle and usually unconscious forms of bias that are rooted in stereotypes. And because they're rooted in bias and stereotypes, these derogatory and prejudicial actions or statements usually are directed towards members of marginalized groups. And we hear it in statements like, well, I don't see color. I'm colorblind. Or statements like, oh, you're overreacting. You're being too sensitive. I'm sure he didn't mean it that way. And these can be really destructive. And I often like to say that microaggressions are only micro for the person committing the microaggression, not the person receiving it. Because the toll can be really, really high in the form of things like depression, paranoia, where you're not trusting your own thoughts about things. You can't trust, your own perception of reality. We see it in increased burnout in the workforce, leading to workforce turnover. And there's a lot of research that's gone into how to combat microaggressions as a result. And some of the things that when I lead discussions on this, one of the things I like to say, the first thing I like to say is, first, we really should stop and listen closely and ask for clarification if you find yourself on the receiving end of a microaggression. So this can be done with statements like, I'm curious. Could you tell me a little bit more about what you meant when you said that you don't see color? And this is easier to do when we assume positive intent, right, from the person who committed the microaggression, because remember, most of the times people are not even aware that they're doing or saying these things, because again, it's rooted in unconscious or implicit bias. So you're not even aware of the fact that you have made this transgression against someone else. And I think for healthcare providers, the more that we can make it about the patient and keep the patient at the center of the conversation as a shared goal, the more successful we become in dealing with microaggressions. And you see it in when we can use statements like, I know we both care about Mrs. Smith's well-being. So how can we approach this differently, right? And another way that I often like to coach people on is role modeling the behavior that you want to see, right? And so this can be seen in statements like, I used to say myself that I was colorblind, until a colleague shared with me that she found that offensive, because she felt that by saying that, I was invalidating a huge part of who she was and making her feel unseen. So it actually made me stop and think about what I was actually saying. And then lastly, I'll tell people is don't be afraid to disengage, right? When things become too emotional or too heated, it's okay to step away, to take a step back and save that conversation for another day. And you can do things like saying, please excuse me, but I'm really uncomfortable with the situation right now. I'm going to take a step back and I'm going to go speak to one of my colleagues. You can always come back later. If you feel safe, if you feel in the right space to come back to the conversation, either with the person, alone with the person who committed the microaggression, or even bringing a supervisor or a senior with you for support, that's also appropriate as well.
Wow, those are some incredible examples. I really could, get my arms wrapped around some of the things you were sharing by those examples that you shared of what we can say, giving us permission to step back during, when we're kind of feeling real emotional. And so the other thing that I'm hearing is the importance of being mindful, having that self-awareness can really help us really connect to what might be getting in the way of the connection, or what might be fostering a better relationship with the teams we support or the patients we care for. So as we kind of come to some conclusion, could you kind of solidify, even reiterate some strategies to overcome some of the pitfalls of implicit bias?
Right. Well, I think, Deanna, you started to really touch on one of the biggest points there, which is the self-awareness, because we see these pitfalls of implicit bias play out when we haven't done the work, either individually or as an organization, and examining our own internal bias, all right, and how that bias affects how we think and how we interact with others, and also the responses that are the way that we interact with people elicit from other people. And again, this lack of awareness actually is where it creates a space where in healthcare disparities live and they flourish. And we see it in the impact that this has on our patients and our colleagues. And so I would say that one strategy then for overcoming these pitfalls is to do the work. There's no way around it. You have to do the work. And for individuals and organizations to make the investment in time and resources and infrastructure that helps us identify and understand our own biases and create that internal awareness as well as that social awareness that is necessary to really create that inclusive and engaging environment that we really want to look for, where we know, where the research shows that companies do the best when they're able to create those types of environments, right? Those inclusive environments built on those foundations of diversity and equity. And so that takes the forms for a healthcare organization that would take the form of, say, providing training in cultural humility for employees, microaggressions. Like we just touched the surface there with microaggressions. There's a lot behind how to deal with microaggressions if you're on the receiving end, as well as if you are the person who committed the microaggression, right? How do you handle that situation? So there's a lot of training there that goes in place. And then also topics of privilege and perspective as well. So these are the sort of the core key concepts that when organizations are invested in doing the work, when individuals are invested in doing the work, this is where we see the most success and the best return on that investment from the work.
Dr. Ayers, thank you so much for sharing some of your experience and expertise with us today. I want to give you the final word. Is there any final thing that you were hoping to share that you didn't have the opportunity to share before we close?
This is a commitment to a lifelong process of learning, of curiosity, of understanding that, no one is expert in this and that we all make mistakes. And therefore, we should allow ourselves and each other grace as we go forward in this work.
Powerful word, grace. Thank you so much.